Which of the following foods should be avoided in patients who are taking a potassium-sparing diuretic, such as amiloride? A. Tree nuts. B. Alcohol. C. Orange juice. D. Red meat. The answer is C. Orange juice. Patients who are taking potassium-sparing diuretics must be counseled to eat a diet low in potassium. This is due to the fact that consumption of potassium-rich foods, such as orange juice, can lead to dangerously high potassium levels. Excess potassium levels can cause heart arrhythmia and sudden cardiac death. A low potassium diet would be recommended for a patient with which of the following conditions? A. Kidney failure. B. Liver failure. C. Gallstones. D. Diabetic neuropathy. The answer is A. Kidney failure. The kidney is the main route of potassium excretion in the body. During kidney failure, the kidneys are unable to remove excess potassium from the blood. This can lead to hyperkalemia, which can cause nausea, weakness, numbness, arrhythmia, and cardiac arrest.
Allicin, a compound with antibacterial, anti-inflammatory, and antithrombotic properties, is found in which of the following foods? A. Garlic. B. Cold water fish. C. Broccoli. D. Cocoa. The answer is A. Garlic. Allicin is found primarily in garlic, and has a variety of properties that are beneficial to the health. It is antimicrobial, anti-inflammatory, antithrombotic, it can reduce atherosclerosis, decrease blood pressure, and act as a mild antioxidant.
Which of the following is the best source of omega-3 fatty acids? A. Grapeseed oil. B. Wheat germ oil. C. Ground flax seeds. D. Shrimp. The answer is C. Ground flax seeds. Half an ounce of ground flax seeds provides over 130% of the dietary reference intake, DRI, of omega-3 fatty acids. An equivalent serving of shrimp is able to provide 15% of the DRI. Wheat germ oil and grapeseed oil are both good sources of omega-6 fatty acids but are not significant sources of omega-3 fatty acids. Which of the following is thought to reduce pain by depletion of substance P when applied topically? A. Purandin. B. Polypeptide P. C. Capsaicin. D. Curcumin. The answer is C. Capsaicin. Capsaicin, found in cayenne peppers and other species of plants in the genus Capsicum, is used in topical analgesic creams to reduce joint and muscular pain. It is thought to work by depletion of substance P in the sensory nerves. What three parts does the brainstem consist of? A. Pons, cerebellum, medulla. B. Corpus callosum, medulla, and cerebellum. C. Medulla, pons, and midbrain. D. Midbrain, cerebellum, pons. The answer is C. Medulla, pons, and midbrain. The brainstem consists of the medulla, the pons, and the midbrain. The cerebellum is an outgrowth posterior to the pons. The corpus callosum is the broad bundle of neural fibers that attaches the left hemisphere of the brain to the right hemisphere. Olfaction is what form of sensory reception? A. Chemoreception. B. Thermoreception. C. Mechanoreception. D. Baroreception. The answer is A. Chemoreception. Olfaction is form of chemoreception, or a translation of a chemical signal into an action potential. Smells are triggered by molecules of volatile chemicals that trigger chemoreceptors in the epithelium of the olfactory cleft. Olfactory nerves travel through what structure in order to enter the skull? A. The cristagalli. B. The cribriform plate. C. The ethmoidal labyrinth. D. The perpendicular plate of the ethmoid. The answer is B. The cribriform plate. The olfactory nerves travel through the cribriform plate of the ethmoid bone. The grooves of the cribriform plate support the olfactory bulb, and the bone is perforated by many tiny foramen for transmission of the olfactory nerves from the epithelium of the nasal cavity to the olfactory bulb. The other structures listed are all bony features of the ethmoid bone, but they do not allow the passage of olfactory nerves. Approximately how many action potentials must be triggered in an olfactory receptor neuron in order for a smell to be detected? A. 40 to 50. B. 1. C. 200 to 250. D. 80 to 100. E. 2 to 5. The answer is A. 40 to 50. Olfactory receptor neurons require 7 to 8 molecules of a volatile odorant to trigger an action potential, and approximately 40 action potentials must be triggered in an olfactory receptor neuron in order for a smell to be detected. What type of cell is embedded in the olfactory epithelium? A. Olfactory sensory neurons. B. Supporting cells. C. Basal cells. D. All of these. The answer is D. All of these. There are three types of cells embedded in the olfactory epithelium: basal cells, supporting cells, and olfactory sensory neurons. All three of these cells play a significant role in the sense of smell, though the olfactory sensory neurons are the only cell type that actually respond to chemical stimuli. All of the following parts of the brain are involved in olfactory sense and recognition except which of the following? A. The insula. B. The arcuate nucleus. C. The piriform complex. D. The orbitofrontal cortex. The answer is D. The arcuate nucleus. The olfactory perception is managed by several parts of the brain, the primary areas being the piriform cortex, the insula, and the orbitofrontal cortex. Other lesser involved areas of the brain include the anterior olfactory nucleus, the amygdala, the entorhinal cortex, and the olfactory tubercle. The arcuate nucleus is an area of the hypothalamus that is involved in regulation of hunger and satiety. Where is the olfactory epithelium is located? A. The eustachian tube. B. The inferior turbinate. C. The sphenoid sinus. D. The roof of the nasal cavity. The answer is D. The roof of the nasal cavity. The olfactory epithelium is located at the roof of the nasal cavity in a relatively large area that includes the superior turbinate and the superior portion of the nasal septum. There are no specialized olfactory cells on the inferior turbinates, and no olfactory receptors in either the sphenoid sinus of the eustachian tube. Which of the following tastes has the lowest detection threshold? A. Sour. B. Sweet. C. Salty. D. Bitter. The answer is D. Bitter. The human tongue can detect bitter flavors at concentrations as low as 8 micromolars per liter. In comparison, in the average person the detection threshold for sucrose is 10 millimoles per liter. The reason for the extreme sensitivity of the human tongue to bitter flavors may be protective, as many poisonous or toxic substances have a bitter taste. All taste buds of the tongue are located in what structures? A. In the palatoglossal arch. B. In the apex. C. In the terminal sulcus. D. In the papillae. The answer is D. In the papillae. Taste buds are located in the papillae of the tongue, a group of structures lining the surface of the tongue from the apex to the base. These papillae are also present in the cheek, the soft palate, the epiglottis, and the upper esophagus. They are not present in the palatoglossal arch. Of the 4 types of lingual papillae, which is the only type that does not contain taste buds? A. Filiform papillae. B. Foliate papillae. C. Circumvallate papillae. D. Fungiform papillae. The answer is A. Filiform papillae. Filiform papillae, the most numerous of the lingual papillae, is the only type that does not contain taste buds. Rather, they serve to move food toward the esophagus, cleanse the interior of the mouth, and spread saliva onto food and mucous membranes. Which of the following cranial nerves is not involved in the sensation of taste? A. The vagus nerve, cranial nerve 10. B. The trigeminal nerve, cranial nerve 5. C. The glossopharyngeal nerve, cranial nerve 9. D. The facial nerve, cranial nerve 7. The answer is B. The trigeminal nerve, cranial nerve 5. The sensation of taste is carried to the brainstem by 3 cranial nerves, the facial nerve, CN7, the glossopharyngeal nerve, CN9, and the vagus nerve, CN10. The facial and glossopharyngeal nerves both communicate sensation from the tongue, while the vagus nerve transmits sensory information from the epiglottis. The trigeminal nerve, CN5, is not directly involved in the sensation of taste, though there is evidence that it is involved in the senses of heat and coolness experienced while eating spicy or minty foods. In addition to the tongue, epiglottis, and pharynx, taste receptors are located in which of the following organs? A. The testicle. B. The pancreas. C. The lung. D. All of these are correct. The answer is D. All of these are correct. In addition to the taste receptors in the mouth and pharynx, taste receptors are located in many other areas of the body. These including the lung, which has taste receptors for bitter flavors, possibly as a mechanism to protect against airborne toxins, the pancreas, the small intestine, the stomach, the brain, and the testis. While the function of taste receptors in the testes is not well known, some research indicates that testicular taste receptors may play an important role in male fertility. Which of the following tastes is not associated with a G-protein coupled receptor? A. Bitter. B. Salty. C. Umami. D. Sweet. The answer is B. Salty. Sweet, umami, and bitter taste are all correlated with receptors for guanine nucleotide binding proteins, also known as G proteins. Taste bud receptors that transmit information about saltiness are triggered by sodium ion channels in the cell wall. Which of the following is not a form of lingual papillae? A. Stratified. B. Foliate. C. Circumvallate. D. Fungiform. The answer is A. Stratified. The four types of lingual papillae are fungiform, mushroom-shaped, filiform, thread-like, circumvallate, and foliate. Filiform papillae are the most numerous, covering the majority of the anterior two-thirds of the tongue. Fungiform papillae are scattered along the surface of the tongue, but are more concentrated on the tip and sides of the tongue. Foliate papillae are located on the sides and back of the tongue, and circumvallate papillae are the large, round papillae visible in a row on the posterior aspect of the tongue, just anterior to the foramen secum and sulcus terminalis. Which of the following triggers sour taste receptors in taste buds? A. Sodium ions. B. Glutamate. C. Hydrogen ions. D. Gustducin. The answer is C. Hydrogen ions. Sour flavor taste bud receptors are triggered in the presence of hydrogen ions, thus acidic foods often have a sour taste. Sodium triggers receptors for salty flavor, while glutamate and gustducin, a guanine nucleotide binding protein, or G protein, are associated with umami, sweet, and bitter flavors. Which of the following is the most superior vertebra of the spine? A. The atlas. B. The dens. C. The axis. D. The coccyx. The answer is A. The atlas. The most superior vertebra of the spine is the atlas, or C1. This bone sits on the axis, or C2, over a bony process called the dens. The coccyx, or tailbone, is part of the sacrum. How many cervical vertebrae are in the human spine? A. 5. B. 6. C. 7. D. 12. The answer is C. 7. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The mnemonic for this is breakfast at 7, lunch at 12, dinner at 5. What bone forms the most posterior and inferior part of the skull? A. The ethmoid bone. B. The maxilla. C. The occiput. D. The sphenoid bone. The answer is C. The occiput. The occiput is the inferior and posterior bone of the skull. It wraps under the bottom of the skull and forms the base on which the head articulates with the spine. The ethmoid bone and sphenoid bone are housed primarily within the skull, and the maxilla forms the upper jaw and part of the orbit. What is the name for the bony protuberances at which the occipital bone articulates with the atlas? C1. A. The onion. B. The external occipital protuberance. C. The external occipital crest. D. The occipital condyles. The answer is D. The occipital condyles. The bony protuberances at which the occipital bone articulates with the atlas, C1, are the occipital condyles. The external occipital protuberance, external occipital crest, and onion are all part of the occipital bone and serve as the attachment points for various muscles and ligaments. What suture joins the frontal bone to the parietal bones? A. The parietal suture. B. The coronal suture. C. The frontal suture. D. The sagittal suture. The answer is B. The coronal suture. The suture that joins the frontal bone to the parietal bones is the coronal suture. The sagittal suture joins the two parietal bones together along the sagittal plane of the skull. There are no sutures named after the frontal or parietal bones themselves.